donor sites, there's no difference between the quality of the fat of the different donor sites, and it's up to the surgeon. We can choose the area more appropriate. In my preference site is the lower abdomen. I think it's easy to take harvest, and the quality of fat is good. Anesthesia at the donor sites, we normally for face we don't take a lot of fat, so we do the under local anesthesia, and we can use a clean solution. For smaller area, we use more concentrated lidocaine, for example 0.25 to 0.5 lidocaine with epinephrine. The vasoconstrictor is very important. It helps avoid bruising, hematoma, and more complications. It's the infiltration cannula. We do the infiltration and we massage and wait for the action of the epinephrine, so we can have a very good effect. For the harvesting, we use small cannula around 2.5 or 3 millimeter diameter with a multi-opening. The harvesting pressure should be very low to keep the fat cell intact. It's around 500 milligrams of mercury, or half of the ATM and half of the bar. The syringe aspiration is the one preferred method, but you can use the machine, suction machine, wand machine. My preference is I'm using syringe aspiration, 20 or 50 cc. Preparation of the aspirate, we can use the decanting or the classic squeezing or centrifugation. And the different, many studies shows that no difference between no difference between the results between the methods of the preparing. So I use the centrifugation. Tune-up. Adjunctive agent, we can add many things, but in my practice I use the PRP, 50% PRP and 50% activated PRP. This is the PRP harvesting, and then we divide it into two and activated half of this and put the rest, put both into the harvesting fat. Injection method. The cannula, small cannula, about 19 gauge is used. Bigger size for the breast, for the bottom, but in face, 1 millimeter diameter is the best one, I think. And we use the syringe, 1 cc, for delivery of the fat. And maybe we use some guns. This is when for the injection, we do use the 1 cc syringe for face. It's volume distribution at the recipient sites. We do the seeding, divided the fat graft into very small particle, not threading. So 1 millimeter, cubic millimeter fat has each side is the ideal size. With the online technique, multi-pass, multi-tunnel, fanning out, retrograde injection, and sub-Q injection for the subcutaneous injection for the more rejuvenation effect. When you inject deep, you inject volume, but the more you closer to the skin, the epidermis, you have the rejuvenation effect. Not too much. Don't over inject it. There is many kind of guns that help you, but I think this is a mouth gun. I use this because it can deliver very, very small, very tiny particles of fat of each shot. You see, one shot, this and 1 cc cubic cc of the fat can divide it into 120 small particles. So it's very, very important if you want to have an even regular and